Welcome, everyone. I'm Dr. John White, the Chief Medical Officer at WebMD. If I asked you 5 years ago, would you get your healthcare at Walmart? You might look at me as if I were crazy. But today, if I ask you the same question, you might reply that you prefer to get your care there. Walmart is opening health centers across the country. Sure, it includes the pharmacy, but so much more. And it's all literally under one roof, while you shop for food, clothes, and household items. How is this changing the way we deliver healthcare, as well as how we define health? I had the opportunity to tour Walmart Health in Springdale, Arkansas, with Dr. Cheryl Pegus, the Executive Vice President of Health and Wellness at Walmart. We talk about the impact of the pandemic, the importance of providing care in underserved and vulnerable communities, as well as the integration of retail into healthcare. She provides us a glimpse of what she thinks healthcare will look like in just 2 years, as well as what keeps her up at night. Cheryl, thanks for joining me today. It's great to see you again.
Thank you so much for doing this with us. It's great to have you at Walmart. I'm interested and excited to share with you what we're doing.
You started your new position during the pandemic, a new role. How did that impact what you were trying to accomplish?
So I think over the year in 2020, we were all seeing the impacts of COVID on many communities. And what we all knew was, how do we, one, educate the community? How do we make sure everyone gets education, not only those who have access to healthcare systems and physicians, but other communities? As you know, we've known each other for a long time. I'm really interested in health equity. We were also looking at rolling out new vaccines. And I'd started talking to Walmart early on in the pandemic about what they wanted to do for the communities that they serve. We have over 5,100 stores, but 4,000 of them are in medically underserved areas. And their commitment to wanting to make sure in rural communities and underserved communities, when vaccines became available, there was a place to go get them. Because as you know, medically underserved means there aren't enough doctors' offices. It really resonated. And they wanted to partner and do everything that was necessary.
As you pointed out, 80% of the immunizations that you did were in medically underserved areas. Why was that successful? You mentioned a couple words. You mentioned trust. You mentioned partnerships.
Yeah.
How did they play a role?
So it's really interesting. Walmart has about 1.6 million associates in the United States, 1.6 million. And in these 5,100 stores that I've mentioned, in each of those communities, our associates who work in those stores, they actually live in those communities. And so the first thing that we spent a lot of time doing is letting our associates know the importance of COVID testing and COVID immunizations. And why did we do that? One, we got to hear from them, be you in Alabama, Arkansas, or in New Jersey. Here are the questions I have. And if they had those questions, then their families would have those questions. Then people in those communities would have those questions. And frankly, John, we began tailoring community by community, zip code by zip code, what those needs would be, what those partnerships would need to be successful. So if you needed to partner with the NBA in the Bronx, we did that. If you needed in Alabama to partner with the NASCAR so that there were, again, people they trusted, leaders they knew, or in Southside Chicago with aldermen, we did all of that. And as you know, it was an everyday job, every week, realizing who did you need to partner with for trust, how do we build that, and then executing what I think has been, for me, an incredibly humbling experience, a logistical system of associates who wanted to do it right. And so it's how we've spent the year, but starting first with our associates and then moving outside to the community.
And historically, as we know, the healthcare system hasn't been very engaging. It's very hierarchical, patrician, the doctors in charge. But COVID has also, in many ways, changed how we view health. And I wanted to ask you about that, because that's in many ways what you're doing here at Walmart. How has that definition of health changed?
Yeah, so it's interesting. I think that we as physicians, we know everyone has a different threshold for for when they'll see a doctor. We also know that many people may not understand that no, having diabetes is not something everyone in your family is going to get. No, you're not all going to need a wheelchair later on. But I do think, even as we physicians know that, we don't always know where do you start with someone to prevent any of the sequelae of disease of occurring. We're so accustomed to sick care. We're accustomed to,
Sure.
we'll see the person when they come into our office. Our approach is very different. If you're coming into our store and you're coming in even at the front door, we're sharing with you, there are healthy foods that you should be able to eat. If you go to my optical site, which is also in the same store, and you get your eyes examined and you say you have a family history of diabetes, well, we're also directing you to, by the way, we have the lowest cost over-the-counter test strips. Make sure you're aware of that. And while you're there, there's education. So there's almost an environment of everyone feeling, I have a role in keeping the people who come to us healthy.
Well, I want to turn specifically to Walmart and give some statistics, which I think are very impressive, which people all want to know. You've opened at least 20 medical clinics.
That's correct.
Over 200 million people, correct me if I'm wrong, 200 million people use Walmart, either in person or online, every week.
Every week.
And you've been talking about, and I need to ask you to help explain it to me, this omnichannel approach
Sure.
to care. So what does that mean?
I think we're all aware that for being able to seek healthcare, if you can take the day off from work and go to your doctor's appointment, and you can schedule it 3 months in advance, that's how we provide care in the United States. That's what it requires. It requires time, it requires planning, and then on top of all of that, you need to be able to afford it. So
And do it all on the doctor's terms.
And it's all
right?
on the doctor's
Someone else's.
terms.
Their time matters.
This is different. This is saying to people that, would you like to get care Sunday evening at home? Because you're trying to decide, should I go to work tomorrow? Am I too sick? Or I have a child who's sick and I'm wondering, should I stay home? What do you do at that point? What are your options on a Sunday night today in healthcare? You go to the emergency room. You may try calling a physician and hoping you get a response back from a physician who's on call, if you happen to have a primary care physician. And we're all aware in this country, about 25% of people don't have a primary care physician. So your options of real time being able to solve something that will help you not just maneuver through the healthcare system, but actually lower costs, because the highest cost option is actually going to the emergency room, they're quite limited. What we're trying to do is give those options. We're not trying to take away emergency rooms or healthcare systems or existing primary care. We're saying, how do we expand that infrastructure so that people get care when they need it? And the ways we're doing that, you've mentioned, it's not just through our brick and mortar sites, the 20 that we've opened, and we're opening this year in Florida. We're adding 5 sites in Florida. We're adding 2 more sites in Arkansas, and we're continuing to build out. But we've also added, and last year acquired, a virtual health company, so that on that Sunday night, you've got someone to talk to who can see you. And by the way, our pharmacies are open at night as well, if you need to receive treatment. So what we're trying to say when we say omnichannel, it's not omnichannel from what we provide, it's omnichannel from how you access healthcare. You can access it any way you'd like. And so we're looking at virtual health, we're looking at in-person health, we're looking at what pharmacists do. We're also looking at what our community health workers do. We're building out a model that we hope allows everyone to practice. Everyone says at the top of their license, but what we're actually saying, it's allowing you to practice without burnout, because we're giving you the support systems around you. And that's what we're building when we think omnichannel. Omnichannel is, I actually need help being able to figure out how to afford food. We've got a community health worker who will help you and who will stay with you until we figure it out. And by the way, we deliver food to you. And food is health. That's part of our omnichannel strategy. So that's what we're really doing. It's what do you need to stay well in your community, and how are we doing that for you? That's what we're trying to do.
Well, let's see how well Walmart is doing. I want to read you a quote from you. You say, Walmart is in a unique position to provide quality, affordable health and wellness services to all Americans where they already live and shop. Now, the pushback would be from big, prestigious academic institutions or doctors' offices that'll say, Dr. Pegus, they don't want to go to Walmart where they shop. They want to come in to the doctor's office. They want to come in to the big, prestigious academic center. Who's right?
So I think I would say if everyone in this country had a place to go for healthcare, and if everyone in this country had a primary care physician, healthcare would not cost $3.8 trillion. There isn't an either or. It's that we don't have enough to provide care for people who live in this country, period. And so what we're attempting to do is help fill gaps, but become part of that ecosystem. We're not going to replace all the primary care practices, but people in the communities that are HRSA designated medically underserved areas, they don't have enough primary care physicians. So we're building sites for them to have those.
And these are not same-day clinics, so people know. These are, you're getting your primary care.
You're getting your primary
at
care,
Walmart Health.
and you can schedule it online. You have follow-ups. Frankly, 50% of our visits are follow-up visits. There are people who seek their care at our sites. And why is that? Our sites are open 7 days a week. Our sites allow an integration of telehealth with in-person care. One of the few companies, as you know, that's already doing that. We have integrated optical and dental right in one place. And so you're coming in, and if you come in and you have your appointment and you have your family with you, well, people could be shopping for groceries while you're getting your eyes examined. That matters to busy families. It matters to people who are caregivers, who are bringing in elderly members to receive their care. Our goal here is, how do we help expand best quality care? Our results to date, it's not just return visits. Our NPS scores in our clinics, they average between 78 and 81.
It's pretty good.
We've had a 150% increase in the volume of people utilizing our services. We are NCQA accredited for the work that we do. And so I would say for those of us in healthcare, we want to give the best quality care. It's that within our current infrastructure, we need to expand that, and we need to expand the definition of where you receive care.
Well, I want to move to that, and I want to talk about social determinants of health. You and I met many years ago, I won't say how many, when we were talking about HIV and the disparity that still persisted then, that persists now, primarily in people of color. But you and I also share this concept that health happens when you leave the doctor's office, and that's a mindset change. So I want to ask you about, there's a lot more attention now focused on social determinants of health, more than has been in the past few decades. But to be a little bit of a cynic, what's different now, Cheryl? What's going to change it? Because people have been studying it for years. We don't need more studies. So what is Walmart and Walmart Health doing that's going to be different, that's going to have an impact in addressing the social determinants of health, which we know have an incredible impact?
So I have to tell you, it's probably the question that always keeps me up. Because as you've said, I think many people know, I entered healthcare to address social determinants of health, to improve health
when it
equity.
wasn't popular.
And it wasn't popular. And if you recall, you know, you and I would talk, it was almost like it was a club of people saying, hey, we've got health disparities. Do you remember when we used to say it?
We knew all the same, there were only a handful of people. You could
all
know
of
everyone.
us in the same room.
That's right.
Always having that conversation. So what we have right now is COVID showing people that if you address health disparities, if you address social determinants of health, we could change the trajectory of healthcare. This is the first time I think the data is not just in the scientific domain or in the people who care. Everybody has seen it. Everybody has seen the data. And I think again, once the data has been shown public, everybody's got to think about what we do. I think what worries me the most when you talk about, what happens is, can we sustain this 10 years from now? Right now, everyone's interested in it. Will everyone be interested 10 years from now? And so what's different about Walmart? I think we talked about a little bit about the fact that, look, when you go see the doctor, that's for a finite time. It's actually, right, 15, maybe if you're lucky, a 20-minute visit every 4 months, maybe twice a year, once a year, but you're living a healthy lifestyle outside of a doctor's office. So healthcare and wellness does not occur in a doctor's office. What you get is you're getting, hey, treatment for a specific condition, but if you have a chronic condition, you have to go home and manage that condition. Who's helping you do that? And I think doctors have been trying to do all of it, right? They know
Not
they've got to talk about
sometimes, yeah.
food. They know they've got to help people understand why they take their meds.
It's
But you need
everything
a
in
team.
this room, I've noticed, and it's by
It's
chance.
exactly.
Family, fitness, fun, food,
It's
self-care, community.
everything.
But that's not what we talk about in the typical
We do
healthcare
not.
environment, but you're focused.
This is
on
our
that.
focus. And so if you think of what 100% of health is, 40% is social determinants. And what does that mean? Access to fresh food, access to when you need help, you pick up the phone and you call. Someone says to you, I'm here to answer your questions. 30% is about personal behaviors. So if you had high blood pressure today, do you know that you should be measuring your blood pressure at home? Do you know how to do that well? I don't need a doctor to tell someone how to do that. Only 20% is going to the doctor. So just think about that. 40% social determinants of health, 30% personal behaviors, and only 20% is clinical. That's 90% of healthcare. And just so everyone's asking, what's the other 10%? It's those environmental and genetic things, frankly, that we haven't cracked the code yet on in healthcare.
How are you going to change that? What's it going to be from the work that you're doing
So
here?
I think for us, we want people to know that access to fresh food is one of the core determinants of great health. And at Walmart, we are the largest provider of organic fresh food at the lowest price in the country.
Wow.
In the country. And as we've seen, as everyone has gone through, particularly as we're looking at 2022, we are partnering not just with payer organizations, not just
That's
with
back
health
to your
systems,
partnerships, right?
not just with
Interest.
with community organizations, that fresh food, if someone is thinking of becoming pregnant, fresh food matters. If you have diabetes, fresh food matters. If you have high blood pressure, fresh food matters. I think sometimes we forget to say that in your physician's visit because we're thinking of, are you taking your medicines? And even if you said it, many of us don't have the time to help someone walk down the aisle and pick out the right foods. Well, if you're shopping with us, I've got a community health worker who will do that with you, who will ensure that it's being delivered to you if you're saying, I can't travel to come get that.
Wow.
We will make sure that happens. If you need to take insulin, which for as we know, growing medical issue in this country, and one of the main reasons is the cost of insulin. And I would tell you, Walmart, definitely even before I started, just thinking of commitment, knew that that was a major issue and developed our own Walmart branded insulin that is 75% less expensive than what's out in the market. 75% less expensive. Rely on our own insulin. And we have all of the test strips and everything that you would need. It is the lowest price, again, in the country for being able to receive it. So our goal is to make it accessible 7 days a week. Make sure that if you need someone to help explain to you why you're doing it, it's someone from your community, our community health workers and everyone that I've mentioned. They live and work in the community, culturally appropriate, health literate, assuring that you have the right information. And we want to make sure we're delivering it to you however you'd like to receive it. And so now it's ingrained. And I think that is what we're working towards. And we are very comfortable saying, oops, we have to try that again. And we're doing that.
What about people that will say to you, Cheryl, you're making healthcare retail. And healthcare isn't like buying a car or buying a dress. What's your response to that criticism and that mindset of how healthcare is different? is
Yeah, and
separate.
by the way, so what I always say to people, it's not that what you said and I said are opposite. It's that they're complementary. If someone needs to manage heart failure, you're right. They should be seeing a cardiologist. Our goal would be to get them to a cardiologist. If someone has severe rheumatoid arthritis,
Mhm.
our goal is to get them to see the best specialist. But people have other needs. If you have rheumatoid arthritis, you need your eyes examined. If you have heart failure, you probably need to be checking not just your weight, but your diet. Who's doing that when they're not with you? We're complementary.
I want to turn to you and your story. And as I've said, I've known you for many years, immigrant from Trinidad, raised by a single mom. Now, this I actually did not know. A
Uh-oh.
double major. I'm impressed. I'm always impressed when someone's a double major, but a double major in biology and African American studies at Brandeis, an MD from Weill Cornell Medical College, an MPH from Columbia. You're now in the C-suite of the US's largest private employer, woman of color. What's your reaction when I
When you
read
say
a
that,
brief vitae of you?
I think my mom is probably helping you write some of that. That's what I'm thinking. Look,
Because let's be honest, there aren't many women of color in the C-suite. There certainly
yeah,
aren't enough. There aren't enough women CEOs of healthcare systems. You've broken many of these
yeah.
barriers.
So how do you get here?
Mhm.
I think you get here not by yourself. And I knew I was going to go into medicine. I had my grandfather who was really sick when I was younger, and we couldn't afford healthcare. I mean, I was 12 years old, and now today I'd probably say it was probably a diabetic ulcer, but I was doing wound care at 12 years old. It's just not something, I think it stuck with me, something
Mhm.
I ever wanted to see another child have to do. And throughout my career and my life, I have found people who will help me get to where I want to go. I probably have a little bit of tenacity in me.
Mhm.
But look, I was the first Black female cardiology fellow at Weill Cornell.
And that's not that long ago
And
when
it's
we
not
put that
that
in
long
time.
ago.
Mhm.
And I just remember actually even interviewing for those roles
Mhm.
and people going, we've never met anyone like you who wants to do that. And I think what I had is going back to Cornell with people who were, don't let anyone tell you you can't do it. Don't let anyone say no. And so I think I also had at home a family who said to me, every day you get up, you do the best you can, and then you're done. And I think that allows you to get up every day and be really optimistic. And I am an incredibly optimistic person, but I'm incredibly fortunate as well because I get to do what I have always wanted to do. And that's been incredibly heartwarming.
What does health, I'm specifically using that term health instead of healthcare, what does health look like at Walmart 2 years from now? So instead of saying 10 years, everybody wants
Sure.
to know that. Just want to know what's it going to look like in 2 years?
And so you'd be sitting at home and your Walmart.com app
Mhm.
opens and tells you, hello, good morning. You're going to have a great day.
Mhm.
Hope you took your medicines. By the way, we recognize you weren't able to afford the last prescription. We called your doctor for you. We've gotten it at a better price. Do you want it delivered or do you want to come by and pick it up? We also notice that you haven't had your blood pressure checked in a while. We're actually sending home to you an ambulatory blood pressure cuff so that can happen. Have a great day.
Wow. With you in charge, I am sure we'll get to that. Well, Dr. Cheryl Pegus, my good friend, I want to thank you for taking the time today, for all that you're doing at Walmart Health and Wellness in really changing how we think about health and how healthcare is delivered. So thank
Thank
you.
you so much. Really, really loved to
Mhm.
enjoyed having this conversation. It was great.